had people, get themselves up and out and go into more positive circumstances. We've had people arrested for felony assaults, things like that.
Right.
So there's more control, and that has led to the population being reduced. But to answer your question about are they contributing to? And the answer is not yet. In other words, this is what I would call we're still gaining control of the population to try and establish that kind of dialogue and relationship.
Okay.
In terms of service provision, from a clinical standpoint, it has made service provision a lot easier.
Yeah.
This is more of an ambulatory kind of a model. In an ambulatory medicine, the first critical thing is where's the patient.
Right.
And when the patient's scattered all over the city, it's difficult to provide service.
That's
So
right.
most of them are there, and they are getting services. Behavioral health is there. The way the rules are set up, any government employee can go in there at any time from any level of government,
Right.
from municipal to federal.
Mm-hmm.
So behavioral health is out there on a routine basis. Veteran VA, they're all out there. We're coordinating with them. We're in conversation. We're in dialogue. We know what some of the outcomes are through them. But I guess what I really would emphasize, and I think the problem that Sacramento probably has, is the fair share concept.
Exactly.
That is how.
Right.
That's how we gain control.
Right.
Because when we just opened it up and we know we're reasonably certain other cities' police departments send people there, go there informally. It's like that doesn't work. So how do you provide service but keep it under control? You take care of your fair share.
Right.
County seats have a problem because there are so many service,
Right.
the jails, the hospitals tend to be around the county seat, so they get dumped out there. Every county seat I've talked to, they have an issue or they have a problem. They have more than their fair share because of that.
Well, let me ask you a question. What is happening with the trends of the increasing numbers of foreclosures down here, the transitional populations? What are you seeing?
We're not seeing a large demand for the site.
Okay.
Let me go back in time though. How we set it up to get control of it was we had 4 criteria that you could get one of these 140 IDs.
Okay.
One, you're known to our code or police department or city staff. You got your 90-day permit and your ID to stay there. You
Right.
got an assigned tent site, or if you had an RV, you got an RV site.
Yeah.
So known to us, or you had leased or owned a house here. School records show you went to school here.
Mm-hmm.
We also looked at police records to see if they had, if there was a frequency of interaction with our police department, and then
Immediate family.
an immediate family.
Mother, father, grandparent.
We also improved that site, like you saw it. We decided, we needed rules and regulations. Everybody needed assigned tent, so we knew who they were they getting services, are they, is there anything we can do to try to get them up and out of it?
Yeah.
And we've used Mercy House. We've got them under contract to watch it on a day-to-day basis. We've got security out there, as you've seen. They're there, we've got crews there, 24/7 right now. And their main charge is just to, keep an eye on the site. If there's any activity there that's not within the rules and regulations, contact us,
Right.
contact the police department. If there's, we put the perimeter gates in. A lot of people said, geez, why did you do those fences, Brent? Isn't this terrible? And I said, no.
No.
I said, people are preying upon the population. They get beaten, stolen from. They have part-time jobs, some of them. They get SSI payments. They do have some things of value, and unfortunately, criminals, gangbangers, and other folks prey upon them and steal that stuff. So that's why we put the fence in, the gates, and we really are, I push this very hard, and I've had a lot of press wanting to get in there, and I tell them no.
Yeah.
Even though I know, and I tell them, I know you can go in there, but I don't want you in there because that is just for them. Give them some privacy. That is
Exactly.
the only home they have.
Right.
You can stand outside the gate. If they walk outside and they want to be interviewed, you do something like where we've done, where everybody has an ID. They've got ties to the city of Ontario,
Yeah.
and only they can use the facility.
What are the key pieces of advice that you want to give him and his staff on how to proceed with what they've got going up there?
Well, right now, they're in a stage like we were in Gabriel, you know, it was the summer of 2007. It's getting overrun, there's no controls there, probably, haven't been up there, but it sounds like it's just people are flocking to this area, just like, but the difference was we set up the area and then they're there. And now I think the thing is, do they, as a city, want to do something about the area, or do they not want to do anything about the area and just have it stop? That's their decision. If they want to do something about it, you know, I'm not saying our model was perfect or anything, but it sure has calmed down the area. It's much smoother now. We've set up that, as you saw, we put a container out there. And that's where the people who want to provide food, they're all scheduled through Mercy House to go out there and do the food distributions. And if you want to give blankets or wood for the fire rings or the barbecue, you know, you do that through Mercy House. That certainly has gone smoother. Before, I mean, we had 10 containers. When we cleaned up the site, I think we had 10 dumpsters we had to haul because people were just backing up and dumping. I mean,
we were finding gardening people bringing green wood with leaves all over it, saying, I'm helping, I'm bringing wood for the home. No, they didn't want to pay the dump fees at the dump. So there they were dumping all their junk, construction debris, wood with nails, I mean, everything.
Bikes you couldn't use.
Give it to the homeless, they can use
bicycles with no tires. It just, why are you doing
But
this?
coordinating everything through all of the service provision through one place really helped a lot.
Okay.
That controlled that. Having the security there so that these people couldn't come in during the day and dump.
Yeah.
That was really important.
Okay.
Having it closed down at 10 o'clock at night and opens back up at 6 really helped.
All right.
Because one thing that I think happens that's, I mean, and we set up areas where people like Gabriel can go talk to them, and not where it's just a free-for-all inside.